All right. Good evening. This is the Town of East Long Meadow Board of Health meeting for September 25th, 2025. And I am going to call this meeting to order. And the announcements from the chair, the Board of Health is recording. Is anyone else recording? All right. And we are holding this meeting via Zoom webinar pursuant to multiple executive orders suspending certain provisions of the open meeting law originally effective in March of 2020. So those are the announcements for this evening. Um, the first item on our agenda is to approve the minutes of our previous meeting. So ladies, did you get a chance to look at the minutes? Do we have any changes to those minutes, or do we have a motion to approve those minutes as written?
I motion to approve as written.
All right, I can second that motion. And we will do a roll call vote. The motion is to approve the minutes as written. So Christine Johnston, aye. Dr. Katie Jobbins.
Aye.
Rebecca Torsha.
Aye.
Thank you so much. All right. Is there anyone here for public comment?
No, ma'am.
All right. Moving on then, business at hand. So Tammy, I'm going to turn this over to you.
Yay, we have really awesome news that the expansion of Public Health Excellence Grant for Shared Services that I applied for was received and approved. And we just received an engagement contract for the grant, and I'm so excited. And I'll just remind everybody about it. So this would be a shared service arrangement between the towns of East Long Meadow, Agawam, Westfield, and West Springfield. And it will be it'll support the cross-jurisdictional sharing of public health services to modernize our health departments, enhancing service delivery and compliance with statutory mandates. And the grants will allow for staffing, training, and resources. And most of the things that we'll be focusing on will be promoting service sharing, establishing statewide data system, establishing essential services, and trying to obtain performance standards. Some of the services that we're hoping to look into would be chronic disease and injury prevention, maternal, child, and family health, and access to healthcare. It's exciting. It's a little stressful because it's like brand new once it goes through. We still haven't 100% solidified what we would like the arrangement to look like. When we submitted a budget, which I have to go with the state and kind of look at, it was like a draft budget. We were looking to get another public health nurse to share for the 4 communities that would work more on things like the maternal, child, and family health. We're looking at an additional health inspector, which would be great because if Alex goes on leave, we're kind of, well, I'm all that's left, basically. While that's the case for our town, for the other communities, like West Springfield, they would probably love to have an extra inspector right about now, with the Big E going on. So it's while the resources are for all 4 towns, we'll decide internally through a capacity assessment with the state what types of resources and how we're going to allocate them. Let's see. I just received the contract, and I think on the Board of Health's end, it's a pretty light lift. Christine will be asked to sign, and okay, hold on. All my notes. Let's see, an intermunicipal agreement, which is basically the agreement to share public health services acted by and through their boards of health, and also a letter of commitment, basically to the program. Once we're up and running, there will be a governance structure that is created where we meet that needs to meet at least once a quarter. I don't believe it has to be a board member. It could just be me or a member of the health department as that, but I don't have the information on that yet. Let's see. Do. Yes, like I said, not pretty light lift, signing some documents. Not too bad. And I don't believe that we'll need to have a Board of Health member on this group that is the governance group. But to be determined, I'm meeting with them on Tuesday to hash out more of the details. And so it's exciting because they've this particular this contract will be for the remainder of this year, fiscal year 26, and through next year. And we will be able to renew, guaranteed to renew up until 2033, which is really great because as part of the SAFE 2.0, this has been earmarked. It is for public health. They won't be taking it away from us. We've seen a lot of other things go away, but this program through the Office of Local and Regional Public Health not going away, which is really good. You have any questions, comments, concerns about it?
This is great. Thank you for applying for this. I think it's awesome.
I think it's awesome too. I'm very happy. And there's a lot of things. Well, basically, while the program pays for additional staff to help for different projects, it also provides additional training and additional payment for additional certifications that we don't have here as part of our initial job descriptions, but as part of the workplace performance standards are required to have. So that's really cool that we'll be able to, do these trainings that we normally wouldn't have been able to afford, and kind of get higher certification. There was something else about it too. And it's for really good towns. Like, we all really work well together. And like I said, in the past, we've sent each other's employees to train with other people. Our nurse went over to West Springfield. We've had people come to East Long Meadow to train with Alex. So it's really cool that we're actually going to get paid to do that for being good friends, good neighbors. And so it's potentially up to, depending on what our final meeting for the budget, those 2 remaining years potentially would be up to $600,000, which is pretty awesome. But that would basically be based off of what we put in the budget for those 2 years. So that's the big fireworks update I'm very excited for. So we go from the nice big $600,000 grant to, it's really exciting that we also just received a micro grant, which is cute, called Waste Not, Want Not. And Liz Bone, our recycling coordinator, applied for it on behalf of East Long Meadow Public Schools, their food service program. And I don't know if you guys remember that when COVID hit, everything went expendable. Nobody's was using real silverware, plates. Everything got thrown out in the trash, and a lot of institutions, not just schools, they kind of stuck with that. So for 5 years, those things have been going in the trash. We've been paying higher trash bills, disposal bills to get rid of it. And so the little micro grant, the Waste Not Want Not, will be buying reusable silverware and trays for the schools. and potentially a donations fridge, uh, because the schools do receive a large amounts of donations, but a lot of times it ends up going to waste because it can't be stored properly because they don't have enough refrigeration space for it. So being able to have it actually last long enough to get on a plate instead of going in the trash is great. So I'm really excited about that. Um, I didn't print off the order that I did the agenda, but on Tuesday, Tom Christensen asked me to speak to the town council, and so I had made a really large report. But then he said just 2 to 5 minutes, so I'm like, I have a nice large report that I'll just go through the report the way I made it. Um, the last, I don't know, let's say that like the last couple months, we we're really like focused on doing a lot of like trash and recycling activities. One of them was we Liz and I drove past every business in town, and noted whether or not you had trash and recycling containers outside. Not for the purpose of ticketing, not for the purpose of any kind of penalties, but to establish um, if the businesses are being offered the proper bundles by their trash companies. Are they being offered container and cardboard recycling along with their trash? Because as part of our regulation that we voted on a couple years ago, the haulers have to offer all of their customers a a bundled plan. And I think it's been really good. It's been because we had them reach out and contact us. At first, the program was the audits were a little rusty, trying to get people to understand what we were trying to do. But we got rid of some of the kinks, and it was nice because if people were like, "Wow, I don't actually have that," um, we were able to, okay, well, this is what you can ask your hauling company who's picking up your trash. This is what you can ask for, and report back to us basically. So that's been really good. And then there's also been finding out some companies are like already natural whizzes at just this whole reduction of waste, which is really cool. People who are already committed to not having reusables or even takeaway containers, which is kind of cool. So that was really big. Let's see. I think we've met since Household Hazardous Waste Day, which was crazy attended. Like there were so many people out there. But we did schedule another one for next summer for August 22nd, which is cool. And then we did have an event at Birchland 2 Saturdays ago, the Green Team event, and that was pretty good. I think we got 245 residents came, and but I guess it was not as much big as it normally is because the event is done in conjunction with Senator and Rep Ash and Oliveira, but it happened to be that it was I don't know what day it was like it was like meet your representative day at the Big E. So they didn't come. So I think that they didn't end up promoting it on their end. So we didn't get as many as we normally get, which is good. Let's see. Lithium batteries. Really exciting. Our new deputy fire chief, Ed Linehan, he actually comes with a lot of hazardous materials experience. And he has kind of helped hone our lithium battery take back. And those would be like your batteries that you're getting, with your Ryobi weed whacker and those kind of things that you're recharging. For the most part, those are the ones that we were getting last year calls about. the back of your trash truck is smoking, or there is a trash container in my neighborhood on fire. People were putting them in the trash. If any type of moisture touches these things, they will start smoking, and you cannot put them in the trash. They become hazardous. So um, we've been able to work with fire to have a safe place to store them. And like I said, Deputy Linehan, he has been writing policies and protocols to make sure that they're safe and trying to promote the residents disposing of them in a safe way. But you can always also stop by the health department. We'll take them and then we'll bring them to the fire department. But I believe it's on Wednesdays they're open to go over and just drop it off. Because Wednesdays is also the transfer station next door is open too. So it's been just so busy, but like in a good way. Let's see. The other thing that has been like this summer, we're starting to see sort of the while we're at the tail end, we're at the height of sort of mosquito arbovirus season. And I know we've talked in the past how this year we decided to switch from using a commercial company to do our mosquito abatement to Pioneer Valley Mosquito Control District actually providing the abatement strategies for us. And it really seems like maybe I'm gonna say that we're seeing a difference in mosquitoes in town based off of I'm gonna say we are based off of the results we've had. This year we've only had 2 weeks over the summer where we've seen positive West Nile virus mosquitoes in town. Whereas I want to say we had maybe 5 separate weeks last summer, where we saw them. And it's great because I think because the mosquito control district director can take the test results and can look at what types of mosquitoes are biting. Are they the ones that do they like birds and mammals? Because if they like birds and mammals, then they're going to spread it. And that's kind of how they determine. So if the mosquitoes don't come first, the birds come in, the mosquitoes come in first, but they'll test negative for West Nile virus until the birds with West Nile virus come in. And typically the mosquitoes that bite on them first don't bite mammals. Then the mosquitoes that bite birds and mammals come in, and that's where you start to see transmission of West Nile virus and AAA to humans. So that's why when we look in the news, we don't see people getting sick until late August and September for the most part, because at this point they are now here. The mosquitoes, the mosquitoes have a lovely pool of West Nile infected bugs to take from. But it looks like with all that surveillance, we've been able to kind of keep that in check. And as far as we know, knock on wood, we haven't had anyone test positive for West Nile virus in town so far this year. I'm knocking a lot. So that's really cool. And based off of some of the things that we've seen this summer, our coordinator for the mosquito control district will be kind of tailoring, because since it's his first year, we'll be tailoring next year's spring treatments off of what he's seen to get an even further jump ahead of the biting mosquitoes. Which, of course, the second time we had traps with West Nile virus was I think the last week of August, and it was like a week after camp shut down at Pine Knoll, and it was pretty close to the camp, so it was like, oh good, there's camp is shut down. At least we don't have to worry about getting those kids out by dusk. But that was really good. So that's kind of exciting. That it feels like we're seeing a positive like change in in our mosquito our mosquito testing, and hopefully we're like, we'll have this. Hopefully, it will continue to improve over the years as well. Yeah. Let me take a sip. Like I got a lot more as I wrote the report. Do. Oh, we don't have to talk about that. Actually, no, I don't have a lot. Let's see. I guess the last thing I really want to just talk about is sort of the vaccines, and we can segue into some respiratory virus stuff too, which would be lovely to talk about, Katie. It was good news that that the ACIP did approve COVID vaccine. I would have loved the
No, they didn't.
language to be more that
They
no
didn't. Nope, Maura Haley did.
Maura Healy.
So,
But no,
ACIP
they
nope,
but they did.
only for 65 and older.
Okay,
So-
I'm saying yeah.
So
As
yeah.
I'm gonna go into the rest of it. And then secondarily, the fact that Robbie Goldstein and our Commissioner of Public Health and Maura Healy kind of went above and beyond, and I mean they've signed the standing orders, so people will be able to get vaccinated. Fantastic. 6 months to 23 months should get vaccinated. I would have loved it if the rest of this was all shoulds and not mays.
No, everyone can. Everyone
yes.
can get vaccinated, is
yes.
what we should be saying.
But I guess I would have loved the language to be stronger, shoulds instead of mays.
So if you look at the actual evidence-based practices of all the national organizations, so the AAP, which is the American Academy of Pediatrics, the American College of Physicians, which is all adult doctors, internal medicine physicians, the American College of OBGYNs, which is ACOG, everyone has come out with position statement, which is based off of evidence around who should get vaccinated, not who can get vaccinated, which is what the New England and Northeast Alliance is doing, and also what the West Coast is doing as well too. And that is what I would recommend people use for their best evidence-based practices for vaccine questions. I have lots of emotions.
All across the board, all across the board. We were so happy. So yes, and it's fantastic. I hope to be able to hear good. I guess I hope to hear from people who have children under the age of 5 to see how their doctor's offices are. How are they offering? How are they promoting? So far, it looks like most of the pharmacies, they're doing only 5 and above, especially when I look at the standing orders. The standing orders say, so far, I haven't found one anywhere that showed anything that was below the age of 5.
Those are still recommended in the pediatrician's offices.
Yeah. So hopefully people will, they will be promoting them, which would be great. I guess it's something that I hope that with our shared services that we'd be able to do more education on that, and even reaching out to pediatricians' offices and seeing where they're like finding the gaps. We actually had been talking to the state. We had their public health nurse. What's her title? She's kind of like a training coordinator. And Ms. Devar, she was working on a vaccine hub, also for promoting pediatric vaccinations. But the the community that was going to become the vaccine hub, it fell through. I don't think we have the capacity to be a vaccine hub in our town, but it would be great if one of our shared services was able to become a vaccine hub, because then we can work with even the schools. We don't have a great vaccine rate here in town for our kids. It could always be better. but hopefully, that could be something that we can work on with the shared services. I'm very excited. But that being said, I think am I not? I want to say I'm not. No, I'm back. I'm mirrored. I was like, I could. We've set up 4 clinics this fall, and all 4 of them are offering both flu and COVID. So I'm super happy about that. We have the 2 drive-throughs are in 2 weeks from now, or right, 2 weeks. The first one's October 9th from 1 to 5 at the fire department. And the second drive-through is October 10th from 9 to 1 at the senior center. They'll be offering flu vaccines for everybody 5 years and up, and COVID vaccines for everybody 12 years and up. Unless that changes in the next week or so, which if it does, I'll be putting that up on the website. And for anybody who's signed up, I'll make sure that they get the information. And then we have 2 indoor, if you prefer not to get vaccinated in your car. We have 2 indoor clinics, October 15th at the library from 3 to 5, and November 4th at the senior center from 10 to 12. And you just go to the town's website or go to Facebook. We have a link to register. Basically all we ask you to do is bring your insurance card and whatever's your favorite arm. Let's see, what's something else I wanted to say?
I'd also add that if folks need other vaccines, I know that other pharmacies in the area are able to offer those. So if folks are like needing a update on their Tdap or things like that, we do have those available at our local pharmacies in our town. So checking in on that, just not for the clinics, but those are available because we were using one of our local pharmacies at work to be able to provide all of those to folks. So if people need them, know that they're in our community.
And the same with like pneumococcal, they've updated the vaccine. So if you got the old one, to get the new one that came out, which is more effective against different strands. And obviously the RSV vaccine is available as well too, which, for the young and the elderly. And then obviously there's more that will come out. The DPH has been sending out newsletters, which has been great around updates. And obviously Governor Healy and the directors of DPH have been very vocal about transparency around what they're putting in place with the standing orders. So you don't even need to have an order from your physicians or your advanced practice providers because the director of DPH is a physician, so essentially signed a prescription for everyone to get their vaccines.
Do you know how for people who are eligible for RSV, is that a one-time? How many?
As of right now, it's a one-time vaccine. We'll see what the immunity looks like because obviously it's been offered now for the first time last year. So we'll see how long it is until boosters needed. And that may change like tomorrow. Like I say it today, and then tomorrow might be different.
Great research study though that came out, like actual peer-reviewed research study that came out about RSV rates and hospitalizations in folks with the vaccine. So lots of really good science even after 1 year.
Absolutely.
Let's see. We have been fielding a lot of COVID calls. And unfortunately, we do not have any test kits left. We just finally, our last batch just went away. The federal program and the federal website has been shut down. So that's not offered. I don't know if anyone's ever been to that. But I suggest it's an interesting an interesting read. And one of the things that we're trying to see whether or not if we could maybe have some buying power if we coordinated with other communities locally to see if we were to be able to buy large batches if they'd be affordable, because it's not a real we don't really have a big budget to purchase them, and we have in the past with COVID funding, but that's gone. So it would be great if maybe we can work with some other towns, and even if we could just get a couple hundred, I think that would be helpful to have that. it's still helpful to use. I know the guidance is not very strong for if you're feeling sick or if you've tested positive, but it's still a really good tool. It's a good, to figure out. It's a good. I think it's a very good tool to be able to have in your arsenal, taking care of yourself and making sure that you and your loved ones are healthy. I think, you know, uh, you react differently if you know you have COVID over if you just have a tiny little sniffle from, maybe something you got from not washing your hands at the supermarket. Um, so hopefully we'll be able to get those back. So stay tuned.
And now the great thing is that they're readily available at almost all the pharmacies for delivery. And so now they're in excuse me, combination. So it's COVID, influenza A, and influenza B. So that way it's one kind of swab, and you're able to get those results as well too. And obviously the big thing I'm telling people, even if you're negative, to retest in 48 hours just to make sure it wasn't too early on in the viral process. And the kits normally come with 2 in them, if not more than that, depending on which ones you get. And the other part too is if you're still sick, practice good hand hygiene. And if you are really sick, stay home. And obviously, if you're around other people who are immunocompromised, wearing a mask, letting them know, avoiding the parties and things like that. So if you can work from home, work from home. That's what I'm telling all the people who are, calling in or I'm seeing in the hospital, unfortunately. So.
The list of like what they're calling precautions for once you decide to go back out into the environment, like wearing the mask and the self-distancing. I feel like they're great for everything. Not just COVID. You got a bug, your fever is over with for 24 hours, you've got back to work. You know, don't use the same coffee pot as everybody else in the office, that sort of thing. Shaking hands, air fist bump. That sort of. But we can do to use some easy little practices every day, like washing our hands, to eliminate it. I just remember back when, like during COVID, when uh, there were little portable hand stations pretty much like around every corner in every school, and the kids just got to, they washed their hands when they got to school, in between classes, before snack and after snack, and how that reduced the number of norovirus and other reportables that we had in our database because we had these great hygiene practices. Um, I mean, if only we could kind of get back to that, but I think that was it maybe fatigue, but well, it's like brushing our teeth and that sort of thing. You just get used to it, make it part of your day. um, that's my list. Had a lot of stuff going on. Oh, I know what I wanted to bring up. I feel like every time we've had a meeting, it's just been we've had to do so much stuff, and we've had hearings and everything like that. And I know we've put off adopting, having a hearing to adopt the model tobacco regulations. Would you guys like to wait and until we've kind of gotten into a better kind of area, a better time frame to do that? Or do you
Is there
feel like
any other updates just before we adopt it? Nothing else has changed.
No, actually, I just last week went to the model, like the model regulation, and they're still using the FY25 one that they
Okay, so
put
then
out
why
as
don't
the
we
model.
just get a executive session on the books so we can talk about that the next time around, because we have to go into an executive session, right?
No, it has to be a public hearing.
Oh, public hearing, but that
Yeah,
where we have to announce that we're doing it.
we have to announce it. We have to put it in the paper.
Yeah.
We have to send out the draft model regulations to all of our tobacco vendors and stuff like that.
It
So
seems like we don't have anything else going on right now, so we probably should just do it. Is my thought process.
Do we need to take a look at those in a meeting before that? That's what I'm wondering, if we've made, like, we have the draft, like, do we have a draft that we are pretty comfortable with putting up for public hearing, or do we need like another round where we actually all look at that? And the same thing, like the color coded, right? Like, this is the recommendation before we have the public hearing. I know it's going to push it off a little bit, but also want to make sure that we're doing due diligence and best practice, because it's been a while. Let's be honest, since any of us looked at that.
Yeah, I'm fine to review it too.
Sounds like that's what we do for our next meeting.
Yeah.
Perfect.
We put that one on the
Okay.
agenda. I know we kind of went through and we had Chris
The tobacco-
Banthen.
No, she did. One of them couldn't come. Remember? I thought.
Yeah,
the
it
last-
was Chris Banthen came instead.
Oh, that's right. Okay.
And he's been kind of moving in and like taking over a lot of
Okay.
the tobacco stuff. So he's like a regular fixture now with the
Okay.
with the tobacco control program.
So should we look for a date to have that meeting then and see if they
Yeah.
can come again?
Yeah. Do we think we need them to come, or do we have further questions for them? I don't want to,
No,
I mean,
I don't think
I'm
so.
okay to personal opinion. I'm okay to just look through it, but if you all feel like we should invite them, I'm open to
I
that
think-
too.
I think they answered all of our questions last time, but I don't think if anything else comes up, we can obviously invite them after.
Yeah.
Yeah, like I said last week, I went to the model tobacco meeting, and they went through it exactly the way they did go through it with us, line by line, sort of what's new, what's different. And it didn't seem like it really wasn't, obviously it's the same document, but nothing new to add to what they said the last time. Excuse me.
That way we're just a little better prepped for a public hearing, that we are more familiar, like in recent memory of that. So that'd be great. And Tammy, if we could get that a little ahead of time so we could all read through it. I know we have it, but a fresh copy would be awesome. Just to remind
I'll-
us. Or tell us when you sent it to us.
Yeah, I can. I'm sure I've got that saved on this laptop even. Yeah, absolutely.
Perfect.
So where do you guys want to pick a day now?
Sure, that would be great.
Yeah.
Thursdays in October are hard for me. But what are the days that we have the Zoom, Tammy, that we could remember? We figured out
Well, the only day that nobody has the Zoom is
this
Thursday.
I cannot do the 9th. I could do this. No, I'm on vacation. I was like the 16th I might be able to do, but my husband and my 10th anniversary is that week, so I took the week.
I'm out of town that
Okay,
day.
great. We're not doing the 16th. I could
How about
do
the 23rd?
the 23rd.
I have a major event at work that I'm not 100% sure if I have to go to, but we're talking an event where I am closing facilities and working with public safety. And so I need to be available for that.
What about the 30th? I can do the 30th.
Okay. Yes.
Yeah, we can make that
I feel
work.
like
Can we do
something
it?
is going on during the day in public health land on the 30th, but it's not on my calendar. But
Okay, well, if we need to change it, just
shouldn't
let
be
us
at
know.
night.
So tentatively, the 30th.
Mhm.
Should we give
Okay.
some other dates, like on a Monday or a Tuesday, just in case, and then we can see if the Zoom is available?
Are there any Tuesdays that stick out to you, that
I could
the 21st or the 28th?
I could do either one if it's from 5:30 to 6:30, just because I have another meeting at 7 both of those nights.
I can't do the 21st. I have open house
Oh, I have
at my
open.
school.
I think I'm pretty sure
Well,
we have
not
open
for my
house.
kids, but for my students.
No, but I
I
was
have
gonna
to
say, I
be
think
there.
And I
one of our
can't
open houses is
do the 14th because I'm at the same conference that I'm at the 16th.
Yeah, I can't do that either. What about a Wednesday? Can we look on Wednesdays?
I can't
I'm
do
booked
Wednesdays.
I have work every Wednesday in October.
I feel like October is a very hard month.
October is crazy.
Is it if there's nobody on the 28th? Does that date also work?
I could do the 20th, but I have to do from 5:30 to 6:30.
5:30 to 6:30.
I could do that.
I can make
And
that.
okay. How about we'll ask if there's anybody, because there's a lot of 5 to 6 o'clock meetings,
Yep.
so that might not be possible.
I can make
if
6
not,
work, but I have to end hard at
Alright.
like 6:55.
but then we'll do, if we can't do a Tuesday, which is that Tuesday was preferable over Thursday.
That the 28th would be my preference over the 30th.
Okay, so if we can do that, but if not, we'll meet the 30th.
Okay.
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 And
Perfect.
if we do 6 to 7, I can do it. I just have to be off of the call at 6:55.
On
The 28th.
the 28th. Yeah. The 28th, 5:30 to 6:30.
Or if you can get 6 to 7, I will be off by 6:55.
That's not the public hearing. So that one we can make
Yeah.
like,
Right.
right. We can,
We can make that happen.
Okay.
Yeah.
Well, do you want to just do 6 to 7 so it's easier for you, Tammy, then?
Well, we'll see what they've got. Because if it's 5:30, that doesn't really matter to
Okay, that's
me.
fine for me. Yeah.
I'm
Okay.
usually at that point I'm throwing like nuggets for the kid in the oven anyway. He doesn't.
We're all surviving.
yeah.
That's
Well,
what
you
I'm
just-
like. Don't ever expect a gourmet meal on Board of Health meeting night.
Mm.
It's gonna
And-
be.
We were crazy people and adopted a puppy and rescued her from Oklahoma, so we have a baby. You want to see her? There she is.
Mhm.
There's the little Rory. She's sleepy. She's recovering from some contagious puppy diseases, but she's on antibiotics.
Oh, adorable.
I know.
So many cute things tonight.
She's a good girl. too. All right.
Okay.
Okay. Are we good? Do we
I'll-
have anything
yeah,
I think we're
else?
good.
I'll keep you. I will reach out to Jamie. Or Renee, can you reach out to Jamie tomorrow about those times?
Yes, I can.
I think I'd like to take a day off. Yeah. Okay. And then hopefully nobody's having. I know that the Tuesdays have been weird, like either every other Tuesday is town council. That's why. But
All right,
maybe.
we'll just keep us updated.
That's
We'll,
fine.
Okay.
yeah,
We'll
we'll
figure
figure
it
it
out.
out.
And any other news out there, I'll let you all know.
Great.
Thank
Then
you.
I can motion to end the meeting.
And I second that.
And I will make the roll call vote. Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right, ladies, have a wonderful evening.
Thank you. You as well.
Bye.
You
Take
in
care, everybody.
October.
Bye.